Hi, I'm Kim Williams. I'm a social worker at U of L Health Brown Cancer Center. I'm the social worker for the breast cancer team primarily. So I work with women from the point of diagnosis on through treatment and survivorship and beyond. So, a lot of what I do is with younger women and older women who are young at heart after their cancer diagnosis, after their breast cancer diagnosis, and trying to help them maintain who they are prior to the cancer diagnosis. So, they're still mothers, they're still wives, and they're still working. So helping them keep healthy, both physically and mentally during that time. More often than not, this is something that they've never experienced and they've never prepared for. So it's a journey no one quite has a roadmap for. So sometimes I provide that roadmap with where to get practical things like help with transportation, help with utilities and rent, help with their children. It just goes on and on. I have a lot of resources in the community that I can refer people to. We have a lot of resources at the Brown Cancer Center specifically that we can help with. So some of those obstacles and barriers that might be getting in the way of them getting the treatment or just going on and living their lives, we can help knock those barriers down. Being able to make an impact on people's lives, and as a social worker, you have lots of opportunity to do that in lots of different arenas. I honed in on the medical aspect of social work pretty quickly and was fortunate enough once to be placed in an oncology unit and then just saw how much need there was. So to be able to go in and really make change is pretty dynamic. So I get a lot from that. I feel like I give a lot and help a lot with patients and their families, particularly in going through that journey. But for me, I get so much from it. I have a lot of patients that the basic things are huge hurdles for them. Literally transportation. They could not physically get to their treatments without some help from the cancer center. Sometimes it is things like, they can't work any longer. And that's not always the case, but for a lot of people it is. And being able to help them fill out applications and find resources to help with their daily expenses. They have small children and they're stymied, as they're just stuck as to how to talk to their kids. I mean, can you imagine talking to your 5 and 6-year-old that you have cancer and what that means and why you're losing your hair? So they need that help. And so I'm able to provide that, fortunately, the time to sit and talk with them about it and the resources to help them do that. I want to make sure you're doing okay, your family's doing okay, that you are doing okay as a mother, as a wife, that you're doing okay as the person that you are.